What if you needed a blood transfusion tomorrow? Would you have a say in where that blood came from or whether it was from a vaccinated or unvaccinated donor? For many, blood is sacred. Leviticus 17:11 says, "For the life of a creature is in the blood." That's why some people refuse transfusions or insist on clean blood from unvaccinated donors. Hello, this is Dr. K. Paul Stoller, and here's the reality. In the U.S., blood banks do not label blood as vaccinated or unvaccinated. The Red Cross says vaccine components don't circulate in blood, only antibodies do. The FDA agrees and therefore doesn't require screening for vaccination status. But some patients remain unconvinced. The COVID vaccine was not a vaccine after all. It was a gene-altering bioweapon that forced the cells of its victims to produce spike protein, a known pathogen. Despite the lies of the Red Cross and FDA, studies show SARS-CoV-2 spike protein can circulate in the blood, especially after mRNA COVID-19 vaccination and in individuals with certain post-vaccination conditions like myocarditis or post-vaccine syndrome. This persistent circulating spike protein, unbound by antibodies, was observed in adolescents with myocarditis after a severe respiratory syndrome coronavirus disease 2 and SARS-CoV-2 infection, and in some individuals with post-vaccine syndrome, even without a clear infection. The fear that vaccinated blood might carry spike proteins or unknown risks is well-founded, and again causing more loss of faith in those we consider authorities. So what are your options if you want unvaccinated blood? There are 3 networks working to connect like-minded people. Blessed by His Blood, a faith-based cooperative linking donors and recipients. Safe Blood, an international group matching unvaccinated donors with patients in non-emergencies. Radius Exchange, a registry of unvaccinated donors and doctors to arrange directed donations. If this matters to you, one key step is having a notarized I do not consent form on file with your hospital. This tells providers you don't consent to blood transfusions outside of your choice. Keep in mind, these options work best for planned surgeries. In an emergency, doctors will use what's available to save your life. The bottom line, you may not be able to control the entire blood supply, but you can prepare. Know your blood type. Join a network if you feel strongly. And most importantly, make your wishes known before you ever set foot in a hospital. Because in matters of health and faith, one thing is certain: choice should be yours.